By now, you've all watched the viral memes and the viral video of BGirl Raygun and her performance at the Summer Olympics in Paris, and where she scored 0-0-0 in her rounds. And I started doing some research into BGirl Raygun, and what I realized is we have BGirl Rayguns in neurosurgery. We have individuals who are at high levels, PhDs, professors, but they are not BGirl Raygun. Rachel Gunn. Now, she's a PhD professor. She's 36 years old, and she actually went out there and performed. Now, surgery is different than being a doctor, because surgery, not only do you have to have mental capacity and you have to be able to make the diagnosis, you have to think about the ramifications of the neurosurgical, but you actually also have to perform. You have to be able to use your hands, you have to be able to do the procedures, you have to make good judgments in the operating room. And what happens when you can't do that? When you're not at that level, when you think you are, like BGirl Raygun, when you think you can perform at that level, but you actually cannot physically do what you believe you should be able to do. What's challenging to me is that we have individuals like BGirl Raygun. Now, I don't know her, obviously. I only know what I've read. She's clearly intelligent. She's a professor. She's done a thesis on this subject, and she knows, I'm sure, the subject very well. She probably knows the history extremely well, but her ability to actually do the procedure, do the performance, is below standards. Now, what happens when you have a neurosurgeon or a surgeon who knows the subject matter? He can talk really well. He goes out into academics, and he or she is able to speak incredibly well, able to publish, able to really build and is important, is actually a very valuable member to the academic environment or to neurosurgery. They can contribute in many different ways. But what happens when they can't perform? What happens when you're like BGirl Raygun? You go out there and you're doing this crazy dance, and your ability to actually make a performance that entertains the crowd, that's really a problem. Surgery is different than entertainment. Surgery is not entertainment. We're actually taking care of people's lives. Now, the ramifications of a poor performance in breaking is that you go viral and people ridicule you and that you're a subject of scorn. But what happens when you're a surgeon and you can't perform? That's more complicated. We don't actually have a solution for this. We don't have a good way to deal with this. Now, you would think that during training, we'd be able to identify those individuals who are not great surgeons, but it's not that straightforward. Most residents or your colleagues, they don't see how others are doing in surgery, because we're always operating with the attending as a trainee. And then even the faculty might say, well, they might not be good at this surgery, but they might be good at some other surgery. And it's actually quite a problem. And as you know, there's the very famous Dr. Death podcast, where you have an individual who can't perform at the high level and is really a menace to society and a criminal. And what happens in that situation? Well, we need to do a better job of policing ourselves. If we don't do it, society does it, the legal system does it. I don't think that's always the best way, because the legal system is always adversarial. I have many examples of my colleagues or even my mentors who may not have been great technical surgeons, but they were able to find other ways that they can contribute to neurosurgeries. And so the definition of success doesn't have to only be your technical skill, but there needs to be self-awareness. And I think that's where we have problems. Sometimes there is no self-awareness, and I've seen some comments online about Rachel Gunn or BGirl Raygun that she may not have self-awareness of what her skill level actually is, even though she is quite erudite and academic about her chosen field and her thesis topic. So I think this is crazy. We in neurosurgery have BGirl Rayguns. We have performers that cannot perform at the highest level. Do we unleash them onto society and let them perform surgery? Hopefully they self-select and recognize that maybe their technical skill is not up to what their mind wants them to be able to do, and that they gradually shift and move to other areas of neurosurgery that are not as technically demanding. That's what we really want to see. Well, here's an important consideration. How do you, as a member of the lay public, you're not a doctor, you don't have family in medicine, how do you choose your surgeon? How do you know that the surgeon who has great credentials, might have a PhD, might have an MD, might be listed at a top academic center. How do you know that they are actually good at the technical craft of doing surgery? I don't know. Now, I think you have to start with your network. Who around you is in medicine? Ask around. You have to ask members, respected members of the community. But I will say, I have witnessed this. Just because a physician is very friendly, they talk really well, they have lots of colleagues and friends, they may still not be the best technical surgeon. So then who do you ask? You might ask the nurses. Well, the nurses oftentimes, they may not know either because they know who's friendly or they know who smiles to them, but they don't know who's technically the best. I think the only people that you can really sometimes ask are senior level residents. I don't know, this is kind of about how are you going to know what senior level residents think of their attendings or their surgeons? Well, then they also may not be very honest because they have to be very careful. They're not yet full-fledged attendings and they may not be able to say. I don't know, I don't have a solution for this. I think that there are new areas of research that can be employed and I'm looking forward to some of this. So for example, Daniel Donoho here, in these videos, he talks about how he can use artificial intelligence to analyze surgical video to improve surgical training. I'm hoping that this will serve as a way to improve our selection criterion for surgeons. But surgical technique actually gets refined over time. I am a much better surgeon now than I was 20 years ago in training, but I think there are elements that we should be able to pick up during training as to who will be a good surgeon. And when you walk it, so now surgeons, when we watch other surgeons' videos, we actually get a good sense of how they're moving, how efficient they are. Now, surgeons' videos can be edited and there can be a lot. So for example, one thing, when I see a lot of blood in the field, that to me signifies, well, they must either be orthopedics and they're not neurosurgeon, or it could be that they just simply are not meticulous. They rush to get to the prize, which may be the tumor or whatnot. But every step of the way, I think you have to see that it's clean, it's careful. But then you don't want to get bogged down in the details. So somebody who takes too long with surgery is also not good. There's a lot of nuance to neurosurgery or to any surgery, and being able to judge somebody's skill is not there's no simple answer to this. And I look forward to technological advances, hopefully, that will allow us to. But how, again, come back to how does the layperson decide or how do they judge? I don't have good answers for you. I'm hopeful that one day we will have a solution or a way to judge surgeons' technique, not just their charisma, their bedside manner, or their credentials or academic credentials, but their actual technical skill.
Now, I've been thinking about this a little bit more now that I've returned home from my vacation in the Outer Banks, and I realized that there's other aspects to this. Just because you're the best technical surgeon, that doesn't mean you have good judgment. So, for example, a great technical surgeon may be like a robot that can physically get out these tumors, incredible surgeries, and accomplish incredible things, but they may not be the best person to make the decision when to do the surgery. And that's also very important as well, because surgery always has some risks, and no matter how great you are, you can never eliminate completely the risks, and some of these surgeries cause problems regardless. The reality is that most of us have talent that is distributed along the bell curve. I believe that there is still something very important about 10,000 hours. Lots of practice makes you better, more efficient, and obviously makes you a better surgeon. In the absence of any specific way to determine who's the best surgeon, my advice to you is to look for the surgeon who does that procedure often, every week, all the time. The more repetition, the more likely that surgeon is going to be excellent at that. Overall, I think that our field is broad. We have the ability to include many different types of skills and strengths in neurosurgery. However, if somebody has multiple standard deviations below what's needed for neurosurgery, we need ways to filter them out.